Hello everybody and welcome to this Next Generation NCLEX case study. This one will be on abdominal pain. So our scenario is a 26-year-old female client is admitted with complaints of right lower quadrant pain. She states she is not nauseous and has eaten very little due to loss of appetite. Upon assessment, you find she is guarding her abdomen and she has rebound tenderness upon palpation around the navel. She denies changes to her bowel patterns and recent weight loss. Vital signs are temperature of 99.9, blood pressure 132/80, pulse 110, respirations 22, oxygen saturation 98, and her pain is an 8 out of 10. So the first question here, this is one of the Next Generation NCLEX types of questions called a bow tie. So you'll select two actions to take, one like condition that they're most likely experiencing, and two parameters to monitor. So I'll give you guys a couple seconds to write down your answer. We'll go through, I believe, 4 questions today, and then the answers will follow, but we'll go through the questions first. So, all right, I'll give you guys a couple seconds. Alrighty, if you need more time to get your answer, please pause this video. So question number 2, the patient has pain upon palpation between the belly button and the right anterior pelvic prominence. What is that called? I'll give you guys a couple seconds to answer this. If you need more time, please pause the video. So our update here, lab values are back and her white blood cell count is elevated at 22.4. Her liver enzymes are normal. The CT scan shows appendicitis, so she will soon go to surgery. The doctor ordered the following medications prior to surgery. Fill in the following chart to complete the list of medications you will be giving. So we have morphine here. The dose is 4 milligrams every 2 hours PRN. Using the options for A, select which option you believe for the drug class, and then indication is 7 out of 10 pain. We have Zosyn, 3.375 grams, IV over 30 minutes once. It's an anti-infective, and then you'll select the indication. Ondansetron, otherwise known as Zofran, you'll select the dose, route, frequency, and then the drug class antiemetic indicated for nausea. Alrighty, if you need more time, please pause the video. Question number 4. The patient is now 1 day post-surgery and will be going home. You provide education about signs of infection prior to discharge. 5 days later, she comes to the ER with these following symptoms. What signs alert you to signs that she may have an infection? Select all that apply. Okay, going on to the answers. So for the first question, the condition most likely experiencing is appendicitis. So good job if you got that right. Actions to take. Out of these 5 actions, the most important ones we want to take are start an IV, because they'll likely need fluids or IV pain medications, things like that. And then prepare the client for a CT scan, because that is one of the diagnostic tools for appendicitis. Also with starting an IV, for her ended up giving Zosyn, things like that. So that's kind of what we'd anticipate. Zosyn, maybe some pain medications, probably some labs so we can get that while we're starting the IV. And then parameters to monitor. We'll want to monitor for an abrupt ease of pain. And the reason for this is if the patient tells you, oh, my pain's gone, it's gone, that could mean that the appendix has ruptured. If a patient tells you, oh, my pain is gone, and they had appendicitis, definitely notify the provider. And then the other thing, we'd be monitoring their white blood cell count, usually elevated in appendicitis, and just monitoring the trend of that. The other answers there are kind of distractors. Assess bowel movements and listen for return of bowel sounds. She always had bowel sounds. I mean, they didn't tell us that she didn't, so that's just kind of a distracting one. Monitor pancreatic enzymes would go along with if she had pancreatitis. So kind of more of just determining what disease she has or what diagnosis she has based on the scenario. Scoring for the bow tie, you get 1 point for each correct answer, 0 points for an incorrect answer, so you're not penalized if you get it wrong. And the total points you receive on this question is the sum of all your correct answers. Question number 2. The patient has pain upon palpation between the belly button and the right anterior pelvic prominence. What is that called? So that is known as McBurney's point. This is simply like a memorization, knowing that McBurney's point is pain upon palpation between the belly button and right anterior pelvic prominence. So, yep, just knowing that, and that this is a sign of appendicitis. Question number 3. So our morphine is given, 4 milligrams every 2 hours PRN. It is an opioid analgesic indicated for severe pain. Piperacillin or Zosyn, 3.375 IV over 30 minutes once. This is an anti-infective, and this one was probably a little bit easier because we know it's an anti-infective, so it's used to prevent or treat potential infection. And then ondansetron or Zofran would give 4 milligrams IV, antiemetic, and it's nausea. Question number 4. The patient is now 1 day post-surgery, will be going home. You provide education about signs of infection prior to her discharge. 5 days later, she comes to the ER with the following symptoms. What signs alert you that she may have an infection? So looking at this one, we're just looking at classic signs of infection. So fever greater than 102. That is a fever, so that would be an indication. Purulent drainage at the incision site, yes, of course. Purulent drainage is yellow, so that there's likely an infection there. The incision site is red and hot to touch, so it looks irritated, it looks inflamed. Skin is cool to touch. No, it'd more likely be warm, the site at least. And then feelings of dizziness is kind of just, it could be a lot of things, but not really related to infection. So scoring for the select all that apply, you get, and you might already be having these types of questions in your nursing class, which is nice, but you'll get 1 point for each correct answer, subtract a point for each incorrect answer, and the total points is the difference between your positive and your negative points. So you can kind of add up to see what you got on that last question. If you were to end up with negative points, so you select, which could happen, you select all incorrect answers, more incorrect than you do correct, the number is just capped at 0. You don't get like a -2, -3, it's just capped right at 0. Alrighty, thank you guys so much for watching. I have a couple other videos on heart failure and sickle cell disease, and this one was abdominal pain. So if you want to take a look at those other case studies, please do. And subscribe to my channel if you would like more videos like this about preparing for the next generation NCLEX. Thank you guys so much for watching, and have a great day.